The global scourge called COVID-19 took the world by storm late 2019 from the city of Wuhan, China. And on February 27, 2020, the Federal Ministry of Health confirmed the first coronavirus disease COVID-19 case in Lagos. It was an Italian who works in Nigeria who returned to Lagos from Milan, Italy. Prior to this development, Nigerian government, through the Ministry of Health, had quickly begun strengthening measures to contain and control the pandemic. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, NCDC, immediately activated its Emergency Operations Center. The federal government also inaugurated the Presidential Task Force, PTF, to commence daily briefing on the pandemic. It is on record that in August 2020, the United Nations commended President Muhammadu Buhari for his leadership in response to COVID-19 pandemic. Now, 1 year on in the battle against the disease in Nigeria, this edition of Frontiers will be examining the successes, challenges, and the way forward. Our guest is Dr. Ejike Orji, Chairman, Medical Subcommittee, FCT Ministerial Expert Advisory Committee on COVID-19. Dr. Orji, you're welcome to Frontiers.
Thank you, Nancy, for having me.
Welcome, Dr. Orji, once again.
Thank you.
Now, you are part of the team. Making a throwback at how Nigeria's coronavirus story evolved, how would you say Nigeria has handled this COVID-19 1 year on, bearing in mind the second and the first waves?
Yes, I would say we did very well. If you look at, usually when you look at the pandemic, you look at the healthcare system before, during, and probably after the pandemic. When the pandemic broke, we had literally just about 4 PCR centers, testing centers around the country. And that meant the testing capacity for Nigeria was very, very low. And also we had a very weak healthcare system. And then that meant for people who are going to be critically ill, something has to be done very fast to be able to treat them. And another thing is that globally the virus was largely unknown, even though people had snippets. They know it's a coronavirus, but this particular variant, it was an unknown quantity, so to speak. So with all of that, and then looking at 1 year afterwards, the number of deaths is still below 2,000 in Nigeria, at least the ones documented. It's still like a miracle because all the pundits, everybody outside this country, most people, in fact outside Africa, looking at what was already going on in Europe and Americas, now felt that Nigeria or Africa would be a killing field for this virus. But it didn't happen. For me, if you look at 2 major things that happened was the response, the risk communication, and the community engagements that happened through the PTF and then all the state governments activating their own pandemic response, just like in Abuja. The FCT minister, in his wisdom, inaugurated a committee under the able leadership of Dr. Modibo Aliyu, who is the overall chairman of our committee. So, and then 4 committees were formed: the medical, the media, and also community mobilization, the logistics, and then of course the resource mobilization. So that's how we rolled out to support the Human and Health Services Department of FCT to be able to do what has happened in Abuja. So by and large, like I said, it's good to commend the efforts of the government being able to foster the collaboration and coordination that happened throughout this process. As we move on, we're talking about the success, and we're going to talk about the challenges and all that. So as we move on, we'll be able to look at some of those things.
Yes, I would like to ask you, could Nigeria have handled this pandemic better by your own assessment? What were the challenges? Yeah.
Well, if we look at the challenges, the major challenges we had was ruling out the PCR testing sites or the bio-level 2 laboratories. And then the other problem we had was there was a lot of conspiracy theory out there. People didn't want to believe that the coronavirus was real, even though the major and most important thing the federal government did was to shut down the country. That helped in doing two things. One, I always say the optics. When you are dealing with a public health issue, you must look at optics. And then that drove it down everybody's spine. That is a serious thing. Anything that will make a government to shut down her economy will tell anybody.
That lockdown, that very first one was actually one too many.
It was real. It drove the fear of the Lord into Nigerians. They stayed home. Then the second thing that also happened was that it gave some respites for NCDC, leading states to start developing testing centers, helping develop the risk communication and community engagement strategies, helped also to build isolation site centers, like here in Abuja. Yeah. The only places that people could go at the time was National Hospital and Gwagwalada Teaching Hospital. And the Gwagwalada Teaching Hospital at the time we were inaugurated had only 10 beds. And the National Hospital had only 5 beds. So totally in FCT it was just about 15 beds. But within 2 or 3 months, our committee working with the HHS and the Minister of Cross, we had almost 1,000 beds in situ for critical, if we divided it up into asymptomatic to mild, moderate to severe, and then critical. So we had, in those 3 levels, we had enough beds to cater for people who would otherwise be so sick. So, and that helped. But the most important thing, coming back to FCT, the minister was advised the importance of increasing testing capacity, and he looked at that and really supported it. If you look at the country now, FCT has the highest test per capita, per population. We got to the 1% mark the NCDC had said and surpassed it. So based on our population. So, and then, if you don't test, you don't find. If you don't test, you don't find. And then your testing capacity is also related to the number of cases that you see on a daily basis. And then because we tested very well here in Abuja, it made it possible for people to be isolated and removed from the community so that they won't continue to infect others. And then also it made it possible to start treatment early. So these were some of the major successes, I would say.
How about the concentration on tackling COVID-19? Somehow, it's always said that it affected some other very debilitating illnesses.
There was no doubt about that. It really affected other services. But, this was a matter of life and death in some cases. And then remember, it's a largely unknown disease as at that time. So you wouldn't know whether, if you say, let me ignore it and focus on other things, what would happen. If you see what was going on already in America and Europe, people were dying in the thousands. Now America is almost 550,000 deaths. More deaths than all the 3 major wars in the past 100 years combined, America has lost in this virus. So for us, if you take a cue from that, you want to make sure that you protect your country. So there was no doubt that other services suffered a lot. For me, that is a women rights activist and a reproductive health and rights specialist. I was also more worried that women and girls couldn't get the services that they needed, especially family planning services, reproductive health care services. That suffered a little bit. It's also going to be really documented. The documentation is probably going on, so there will be a comparison the pandemic.
A lot of people feared going to the hospital at the time.
Yeah, and not only that, a lot of people who otherwise could have easily been seen in the hospital didn't get access. And that was why at some point we had to develop a protocol for triaging patients, meaning if you come, they ask you a few questions, and there will be a pathway to go straight into the hospital and receive services. And then if they ask and they feel that you might be COVID-19, there's another pathway where they will take more care to look at you and probably treat you. So it really affected other services, no doubts about that.
Now, oxygen is a very critical commodity in the fight against COVID-19. How about the accessibility and availability in Nigeria?
That's a very good question. This is one area that I was worried as a person. In the first phase of the virus, the first wave, oxygen wasn't such a critical resource. The reason was, at that time, in a place like Kwakulada, when we had about 30-something patients, there were only 2 patients on intermittent oxygen. Intermittent means they weren't there all the time. But in this second wave, at the point we had 35 patients, 15 of them were on permanent oxygen.
The second wave?
The second
calls
wave.
for permanent
No,
engagement.
I mean, in this second wave,
okay.
15 patients at a time, there were 34 patients in the facility were on permanent oxygen. And then the oxygen supply was not enough, far outstripped the daily production of oxygen there. And that's why I must commend the national coordinator, Dr. Aliyu. That was made, the attention was brought to it, and he quickly worked with the Minister of Health and the PTF, and they made sure that oxygen at least started getting to some of the critical centers, because it became a major issue. And the reason why that happened in the second wave, after the first wave, there was an aggressive, an aggression by both the government and the people to contain the disease. So when the disease came down, people relaxed. And a lot of conspiracy theories now came up. There was no this. And people even accused government that government was using it to make money. How can somebody be so wrong? For some of us, if you know the amount of resources the government put into this, government is not even telling people how much resources. And we saw those resources. One PPE is 50,000 naira as at that time. And when the doctor goes in and comes out, he changes, or a healthcare worker. So the real expenditure in the coronavirus is not really the drugs, it's the paraphernalia to protect people who will go in to treat the ill patients. That was where the expenditure really was. And then the testing also is expensive. As we speak today, government is still testing people free so far as you're not going to travel. It's only when you're traveling that you are made to pay, and when you're coming back, you're made to pay. So if you look at some of those dynamics, you will see in the first wave, it wasn't so serious, but in the second wave, because we are now saying there's no virus, there is no pandemic, there is no corona, they became careless. People were not going to the hospital early enough. So when they go, by the time they spend about 10 days treating malaria, it's when they start desaturating that they now go to the hospital, becomes a dire consequence.
But in all of this, Nigeria still didn't record high level of deaths.
That's what I'm saying.
What could be the reason?
The two reasons that I have judged. Number one is our population dynamics. Our population dynamics. Okay. 70% of our population is under the age of 30. And you know, the younger you are, the more resilient your immune system is, and the more you can fight off the disease. Even though you can still spread it, but the disease won't get you down. That's one factor. The second factor is the aggression and the collaboration and the coordination the government brought to bear on the issue also helped. And then other reasons are the testing capacity that was quickly ramped up. Like I said, before the pandemic, we just had about 4 or 5 PCR centers capable of doing COVID-19 tests. As we speak, we have well over 70 in the country.
Well over?
70 centers in the country. There's hardly any state that doesn't have up to 2 or 3 as we speak. So that shows a tremendous resilience of the
readiness of
the country, so to speak. How we can react. Yeah. So some of us are saying, we hope by the time this pandemic is over, we will be able to revamp our healthcare system the way we have revamped.
Even at the airports, you
Yes.
saw the protocols
Yeah.
or something else.
Yeah, people are obeying it.
Yeah.
That's not to say that we don't have challenges. There are a lot of areas we have a room for improvement. One of them is the continuous engagement, community engagement, and public education. You know, making sure that people adhere to these protocols, because the non-pharmaceutical protocols are still the most important thing to do now until the vaccine is widely available. If you look at the reduction in hospitalizations and deaths in America, it's not the vaccine that is doing it for now. It's the non-pharmaceutical procedures. The vaccines will kick in soon, and that will be sure reduction in the number of hospitalization and deaths.
So, Doctor, by your assessment, it's a success story in Nigeria.
It is a success story by my own assessment, because if everybody thought that Nigeria was going to be a killing field, it didn't happen. But we could also do
We will take a break now, and when we come back, Doctor, we'll look at the next frontier, which is the vaccines. This is Frontiers, taking a look at 1 year of COVID-19 in Nigeria, successes, challenges, and the way forward. Welcome back to Frontiers. Dr. Oji, like I told you, let's look at the next frontier, that is the new frontier, talking about the vaccine, which is used in combating coronavirus pandemic. The Nigerian government is said to have mapped out up to 300 billion naira towards vaccine provision. And the PTF chairman, Boss Mustafa, has confirmed first 4 million doses of Oxford AstraZeneca brand of COVID-19 vaccines for Nigeria. Now, how far will this go?
The important thing is to start. The most vulnerable set of human beings on earth as we speak now are healthcare workers, because they go to attack the disease. And a lot of Nigerian healthcare workers have also passed on because of this pandemic. There was a rollout by the National Primary Healthcare Agency Executive Director, Dr. Faisal, where he elaborated how they are going to roll it out. He rolled out a strategy they called the TEACH strategy, where for me, when I looked at the strategy, it meant actually two major things. One is to do a proper assessment of the resources available in terms of human capital and then infrastructure that will be able to help to roll out the vaccines. Now, the second part will be how to get registered, because the B is A, B, C, D, E, F. So if you look at the B is talking about electronic enrollment of healthcare workers across the country. By themselves, they will self-enroll themselves on their platform, their electronic medical platforms.
The platform has been created.
Yeah, okay. And then the second part of it is assisted, so to speak. People who do not have, healthcare workers who do not have either an Android phone, or they are not tech savvy, and they will need assistance to be registered. And then, of course, the following one will now be the one concomitant. That's as healthcare workers are being registered, then you start registration of other lines of people. And you know that the strategy is to first healthcare workers, then elderly people above the age of 50, and then you now go to people who have comorbidities, and then, of course, the general population. And then the last one is the house-to-house listing for those people who were not able to be, vaccinated through those phases that I had mentioned. So they'll make sure that everybody is taken care of. And I think the Nigerian government is trying to look at getting to 70% population vaccination in 2 years. By 2022, we should be able to get to that 70. And that will give us some level of herd immunity.
Recall that part of the reasons the UN commended President Muhammadu Buhari for his call, for our people's vaccine, which is not just for the rich. This means it is not a political exercise.
No, it is not.
It will not just be.
This is for some of us that are also rights activists, the vaccine has brought up a lot of good. In fact, it's a vaccine globally. The way it's rolled out is the good, the bad, and the ugly. The good and the good part of it is that a lot of people are also looking at the equity. Equity in the sense that where the world is a global village now, we're in one ecosystem. If you feel that you're such a rich nation that you want to collect all the vaccines and use, then make sure you stay in your country, make sure nobody comes into your country. Because those countries you do not vaccinate will come and infect you in the future. So equity,
what goes around comes
yes,
around.
equity in distributing this vaccine is actually forced based on what this disease is. And that's why you can see the global COVAX, this thing, they're able to say they will be able to do 2 billion doses in the next 2 or so years.
COVID-19 is a mutating virus, bringing about different strains and variants. Just like we have the UK strain, they have the South Africa and Brazilian variant. Are these variants considered in making the vaccine?
Originally, when they started doing making the viruses, they considered the first strain of the virus. And you know, the vaccine production had gone so far, even started being rolled out before the UK variant started coming out, the South African variant started coming out. But you see, technology has advanced the speed of this production of these vaccines. Before, it would have taken 10 years. But technology has made some parts of producing these vaccines a lot shorter.
That's encouraging.
And then technology has also, very encouraging, technology has also made it possible for them to tweak the vaccines to be able to take care of new variants. And that's what they are doing right now.
Especially as they're expecting it now.
Exactly. And then one thing I always try to tell people, a lot of people do not know that we are the human being has done so much. I have 2 words I always use: provocative possibilities. No matter how provocative a thought, human beings will make it possible. The human mind and brain is a machine. If you look at, in the 1900s, the average lifespan of a human being was 31 years. If you're 35, you're considered as old as at that time. Now, the lifespan of the average human being now in the world is 71. It has more than doubled in about a century and a half. It is the science of medicine that has so advanced. For me, that is the greatest feat the medical world has bequeathed to humanity. And it's also happening again. With the vaccine coming, COVID will be defeated. The COVID is such a terrible virus that it destroys 3 things. It destroys lives, it destroys relationships, it destroys livelihoods.
It was something else.
It's something else.
Okay.
So that the vaccine is now going to be able to contain that. There is no country that the economy didn't tank in the past 1 year.
Today we have 4 different types of the vaccines. Like we're saying, AstraZeneca, the Moderna, the Pfizer, and Johnson & Johnson. Are their strengths equal? Because I hear that their storage levels are also different.
Yeah. They don't have the same efficacy level. But for me, any vaccine, even if it's 50% effective, is better than nothing. The Moderna and Pfizer has about 95% efficacy. The AstraZeneca is about 60-70%, or about 80.
So why is it chosen for Nigeria?
Now, if you look at the logistics,
AstraZeneca and Nigeria.
if you look at the logistics of the introduction of the vaccine, for the Moderna, it's almost minus 80 degrees Celsius temperature change. We don't have that kind of infrastructure to be able to go around the country. And you have only a window period of 5 days once you remove it from that environment. Whereas the AstraZeneca, the temperature band is already the temperature band that we already used in all the vaccinations that we're doing in the country. So that's why it makes sense to use the AstraZeneca. Even in England, that's what they're using. In Europe, that's also what they're using. So even though the Moderna is much more, the AstraZeneca is also good enough for us.
Nigeria.
Yeah.
Okay. Some countries are already witnessing their third wave. What does it portend? Do you see Nigeria sliding into that?
Well, if you look at there are three things you look at in a virus. One is the biology, the transmission dynamics, and human behavior. Everybody has now known the transmission dynamics of this virus and also some level of interest in the viral biology. But the human behavior is the major thing. If we can behave ourselves, listen to government and obey the rules, then whether the third wave will come and how serious will be determined by that human behavior component when you're looking at viral infections. The reason why a lot of people, morbidities in terms of, if you look at the number of people dying within the segments of the age of Nigerians who are dying, and why it seems as if more people died per unit time now, is just because of the behavior of Nigerians. I have a lot of friends. I lost 14 friends, 14. 7 professors, 4 doctors, 2 judges, and some other professionals. And when I looked at half of them, they never agreed they were actually ill from coronavirus until they started desaturating. They start running to the hospital.
They didn't act on time.
That is the problem. It's still the same human behavior. And it's not because people are less educated. It didn't matter whether people were educated, less educated, the behavior of humans were the same.
On a final note, Doctor, experts say vaccines aren't 100% efficacious. I think you already mentioned it.
No, they're not.
And humanity will live with this coronavirus for quite some time.
Yeah.
What's your advice?
My advice is government is doing quite well, but my advice, if there's any place we have room for improvement, is still in risk communication and community engagement about this disease. It is so key. And then adhering to the non-pharmaceutical protocols. The face mask, the surgical face mask, properly worn, properly used. You know, people wear it and they keep touching the front part. You're picking up the virus again. So if it's properly worn, properly disposed, it will still give us 95% protection. The same way the Moderna virus.
Distance like you and I.
That is it. And avoiding crowded places. If we do the non-pharmaceutical ones, it will help bring this disease down, and the vaccine will now help us eradicate the virus.
Thank you so much, Dr. Oji, for coming on Frontiers.
Thank you for having me. It was my pleasure.
And that's it on this edition of Frontiers, which x-rayed 1 year of containing the global scourge, COVID-19 in Nigeria. Now that the vaccine is here, avail yourself of the opportunity to be inoculated while you continue to observe the non-pharmaceutical protocols to stay safe and blessed. Thanks for watching.
This is NTA International.